Picture this. You're with someone you're genuinely attracted to. The moment arrives, and then nothing. Not because you don't want to, not because something is wrong with you physically, but because your mind just got in the way. If that sounds familiar, stay with me. Hi, I'm Dr. Ella Parker, certified men's sex therapist with over a decade of clinical experience working with men on some of the most sensitive, most misunderstood issues in sexual health. And I want you to know something before we go any further. What you just heard in that opening, I have sat across from hundreds of men who have lived that exact moment. Successful men, confident men, men who had no idea why their body wasn't cooperating, and who were quietly carrying a weight of shame that they had never told a single person about. This channel exists for those men. We talk about the things that don't get talked about, with honesty, with science, and without judgment. So if this is your first time here, welcome. You found the right place. Before we go any further, if you are a man over 40 who wants real, research-backed answers to what's actually going on with your sexual health, hit that subscribe button right now. Every week, I bring you clinical insights you won't get from a quick Google search or a conversation that never happened with your doctor. Subscribe and make sure you don't miss a single one. Now, here's something I want to say before we dive into today's topic, because it connects directly to what we're covering. Performance anxiety, as you're about to learn, lives at the intersection of two things: the psychological and the physical. Your mind and your body are in a constant conversation, and when that conversation breaks down, your performance suffers. Understanding that intellectually is powerful, but having a structured, step-by-step protocol that addresses both sides of that equation, that's a different level entirely. That's exactly why I partnered with an experienced urologist, someone who has spent his career working with men on physical performance at the highest clinical level, to create a complete, start-to-finish program for men who want excellent, consistent bedroom performance. Not tips, not hacks. A full protocol built specifically for men who are serious about showing up confidently every single time. I've pinned a link in the comments below. If today's video resonates with you, and I think it will, go check it out after you watch. It may be exactly what you've been looking for. Now, let's get into it. What is sexual performance anxiety? Let's start with the basics, because one of the most powerful things I can do as a clinician is give something a name. And once you name it, it loses a significant amount of its power over you. Sexual performance anxiety, or SPA, as it's referred to in clinical literature, is defined as a pattern of excessive worry, fear, or apprehension specifically related to sexual activity and one's ability to perform during that activity. It is not a character flaw. It is not weakness. It is not something that happens only to men who can't handle intimacy. It is a recognized psychological phenomenon that affects an estimated 9 to 25% of men, and that number climbs significantly for men over 40. Here's what makes performance anxiety particularly insidious. It tends to show up not in men who don't care about their partners, but in men who care deeply. The pressure to perform well, to satisfy, to not disappoint. These are the very things that trigger the anxiety in the first place. The more invested you are, often the more vulnerable you are. That is not a personal failing. That is human psychology. What does performance anxiety actually look like in real life? It can look like the scenario I described at the top of this video. Being with someone you want, feeling the desire, and then finding that your body simply doesn't follow through. It can look like an erection that arrives and then disappears the moment things get serious. It can look like finishing too quickly because you're so tense, or not being able to finish at all because your mind won't stop racing. It can even look like avoiding intimacy altogether, turning down opportunities before the anxiety even gets a chance to show up, because avoidance feels safer than the risk of failure. These are all presentations of the same underlying issue, and all of them are addressable, not eventually, not with years of therapy necessarily. Addressable when you understand what's actually happening. What's actually actually happening in your body? This is the section that changes things for most men, because the moment you understand the biology of performance anxiety, it stops feeling like a mystery and starts feeling like something you can work with. Here is what happens in your body when performance anxiety kicks in. Your brain perceives a threat. Now, that threat isn't a lion. It isn't physical danger, but to your nervous system, to your ancient evolutionary wiring, the fear of sexual failure registers as a threat, and your brain responds accordingly. It activates your sympathetic nervous system. You've probably heard of this as the fight or flight response. Your body floods with stress hormones, primarily adrenaline and cortisol. Your heart rate increases. Your muscles tense. Blood flow gets redirected away from non-essential functions, including your genitals, and toward your large muscle groups, because biologically, your body is preparing to fight or run. Here is the critical part. An erection requires the opposite of what fight or flight produces. An erection is a parasympathetic event. It requires you to be in a state of relative calm, safety, and relaxation. It depends on the release of nitric oxide, a chemical that signals the smooth muscle tissue in your penis to relax, allowing blood to flow in. When cortisol and adrenaline are flooding your system, nitric oxide production is suppressed. The signal doesn't get through. The blood doesn't flow the way it needs to, and the erection doesn't happen or doesn't stay. This is not a failure of desire. This is neurochemistry. And this is where it becomes a trap. The fact that it didn't work makes you more anxious the next time, which triggers the sympathetic response again, which suppresses nitric oxide again, which means it doesn't work again, which makes you more anxious, and the cycle feeds itself, tightening with every repetition, until the anxiety itself becomes the primary obstacle, even if whatever originally triggered it has long since disappeared. This cycle is sometimes called the performance anxiety loop, and it is the reason that what starts as a one-time experience can become a persistent pattern, not because anything is physically wrong, but because the nervous system has learned to associate sexual situations with threat, and it responds accordingly. Understanding this loop is the first step to interrupting it. The root causes, what starts the loop in the first place. If the loop explains how performance anxiety perpetuates itself, the next question is, what starts it? What throws the first domino? For men over 40 specifically, there are 6 causes I see most consistently in clinical practice. 1. Fear of not satisfying a partner. This is the most common trigger I encounter. Men who genuinely care about their partners often carry enormous unspoken pressure to perform, to please, to not disappoint. That pressure, even when it comes from love and investment, is physiologically indistinguishable from threat, and it activates the same stress response. 2. A previous sexual experience that didn't go as expected. This one is particularly powerful because of how memory works. One difficult experience, one moment where things didn't go well, can become a mental reference point that the brain returns to every subsequent time intimacy becomes a possibility. The brain, trying to protect you, essentially says, "Remember what happened last time?" And suddenly you're fighting not just the present moment, but a stored emotional memory. 3. Unrealistic expectations, often shaped by pornography. For men over 40 who grew up in a different era and now have access to content that didn't exist when they were young, pornography can create distorted benchmarks for what sex should look like, how long it should last, and what a man's body should do. When reality doesn't match that benchmark, the gap becomes a source of shame and inadequacy that feeds directly into performance anxiety. 4. Body image and aging-related self-consciousness. Men over 40 are often navigating real physical changes, shifts in weight, muscle mass, energy, and yes, the natural changes in sexual response that come with age. A longer refractory period, the occasional need for more direct stimulation. These are normal, but if a man interprets them as signs that he is broken or declining, that interpretation becomes a powerful powerful anxiety trigger. 5. Relationship tension or emotional disconnection. Sex doesn't happen in a vacuum. If there is unresolved conflict, distance, or disconnection in a relationship, the body often knows before the conversation happens. Men who are emotionally disconnected from their partners frequently find that the physical disconnection follows, not because of physical dysfunction, but because emotional safety is a prerequisite for sexual vulnerability. 6. The psychological weight of a medical diagnosis. When a man receives a diagnosis of diabetes, cardiovascular disease, high blood pressure, or low testosterone, conditions that are all more common in men over 40, there is often an immediate fear. Does this mean my sex life is over? That fear, even when the condition itself hasn't yet affected sexual function, can be enough to trigger the anxiety loop. The anticipation of failure becomes the cause of failure. How to recognize the symptoms. Recognizing performance anxiety sounds straightforward, but there are symptoms that many men miss or misattribute. Let me walk you through the full picture. The most obvious symptom is situational erectile difficulty. This is the critical clinical distinction. A man experiencing performance anxiety will typically have no trouble achieving an erection during masturbation or upon waking in the morning, but struggles specifically in partnered sexual situations. If erections are happening easily in one context but not another, that is a significant signal that the issue is psychological rather than physiological. Premature ejaculation driven by anxiety is another common symptom. When the body is in a state of heightened sympathetic arousal, the nervous system is on a hair trigger, and ejaculation can happen much faster than a man intends or wants. Delayed ejaculation, or difficulty reaching orgasm at all, can also be a symptom. Anxiety creates a kind of mental noise that makes it difficult to be present enough in the body to reach climax. Avoidance behavior is a symptom that often goes unrecognized. If a man finds himself making excuses to avoid intimacy, going to bed later than his partner, or subtly steering situations away from the possibility of sex, that avoidance is the anxiety speaking. It's a protective mechanism, but one that compounds the problem over time. And then there is spectatoring, a term coined by pioneering sex researchers Masters and Johnson that I think is one of the most important concepts in this entire conversation. Spectatoring is what happens when a man mentally steps outside of his own sexual experience and begins observing himself as if from a third-person perspective. Is this working? Am I performing well? What does she think? This isn't happening fast enough. What's wrong with me? Instead of being in the experience, he is watching and evaluating it in real time. The result is a complete disconnection from physical sensation, and not surprisingly, a body that struggles to respond. If any of these symptoms sound familiar, you are not alone. And more importantly, you are not stuck. The evidence-based solutions. This is where we move from understanding to action. And I want to be very clear here. Performance anxiety is one of the most treatable issues I work with. The research on this is genuinely encouraging. Let's go through the solutions that have the strongest evidence behind them. Cognitive behavioral therapy. CBT. This is the gold standard treatment for sexual performance anxiety, with studies showing improvement rates of 60 to 80%. CBT works by identifying and restructuring the thought patterns that fuel the anxiety loop. The core insight of CBT is that it's not the situation itself that causes anxiety. It's your interpretation of the situation. A man who thinks if this doesn't work, I am a failure as a man, will experience far more anxiety than one who thinks, my body sometimes needs more time to relax, and that's okay. CBT helps you deliberately shift from the first kind of thinking to the second, not through toxic positivity, but through evidence-based cognitive restructuring. Sensate focus therapy. Developed by Masters and Johnson in the 1960s, and still one of the most effective interventions available, Sensate Focus works by temporarily removing the goal of intercourse entirely. Partners engage in structured, progressive touching exercises with no expectation of erection or orgasm, designed to rebuild physical connection and pleasure without the pressure of performance. By taking performance off the table, the nervous system is gradually retrained to associate intimacy with safety rather than threat. The erection, when it returns, tends to return on its own because the anxiety that was blocking it has been systematically dismantled. Mindfulness-based interventions. Mindfulness, the practice of intentionally directing attention to present moment experience without judgment, directly addresses two of the core mechanisms of performance anxiety: the sympathetic nervous system activation and the spectatoring pattern. Studies show that regular mindfulness practice measurably reduces sexual anxiety, increases sexual satisfaction, and brings men back into their bodies during intimacy. This doesn't require hours of meditation. Even 5 to 10 minutes of daily mindfulness practice has shown clinically meaningful results. Communication with your partner. This one is underrated and underused. The shame and secrecy surrounding performance anxiety often make it worse because a man who is silently struggling is carrying the entire weight alone while simultaneously trying to manage his partner's potential reactions. Simply having an honest, calm conversation with a partner, "I've been experiencing some anxiety around sex, and I wanted you to know," can dramatically reduce the psychological pressure. Partners, when approached with honesty, are almost universally more understanding and supportive than men fear they will be. Lifestyle interventions. The research is consistent. Sleep deprivation, chronic alcohol use, sedentary behavior, and poor cardiovascular health all directly impair sexual function and all exacerbate anxiety. For men over 40, optimizing sleep, reducing alcohol, engaging in regular cardiovascular exercise, and managing stress are not peripheral suggestions. They are foundational. Nitric oxide production, the same chemical we talked about earlier that makes erections possible, is directly enhanced by aerobic exercise. Something as accessible as 30 minutes of brisk walking 4 times a week has measurable impact on erectile function. Knowing when to seek professional help. If you recognize yourself strongly in today's video, if the pattern has been going on for a while, if avoidance has become your default, if the anxiety is significantly affecting your relationship or your quality of life, please consider working with a qualified sex therapist or men's health specialist. There is no medal for handling this alone. Asking for help is not weakness. It is the most direct route to resolution. Now you've just absorbed a lot of important information. You understand what performance anxiety is. You understand the biology driving it. You know the causes, the symptoms, and the solutions that actually have science behind them. But here's something I've learned from a decade of working with men. Information alone rarely closes the gap. What actually creates change is a structured system, a clear sequential protocol that takes you from where you are right now to where you want to be, step by step, without guesswork. That is exactly what the program I mentioned earlier is designed to do. I built it in partnership with a highly experienced urologist, bringing together the psychological and the physical, because excellent bedroom performance consistently requires both. It's not a supplement. It's not a quick fix. It's a complete protocol, from start to finish, built for men who are done leaving their sexual health to chance. I've pinned the link in the comments. Go check it out. It might be the most important thing you do after watching this video today. Let's bring everything together. Performance anxiety is not a reflection of who you are as a man. It is a neurological event, a misfiring of the stress response in a context where you need the exact opposite of stress. It is triggered by real things: fear, memory, unrealistic expectations, relationship dynamics, the natural changes that come with age. It manifests in ways that are sometimes obvious and sometimes subtle, and it perpetuates itself through a feedback loop that tightens with every difficult experience, unless it is deliberately interrupted. The good news, and I want you to sit with this, is that the same brain creating the problem is also the brain capable of solving it. The nervous system that learned to associate intimacy with threat can be retrained to associate it with safety. The thought patterns driving the anxiety can be restructured. The avoidance can be gently reversed. The physical conditions that support sexual health can be cultivated. Men over 40 have a particular advantage that younger men often lack: self-awareness. The capacity to reflect, to take information seriously, to be motivated by more than just the moment. If you are watching this video, you have already demonstrated that. You are not someone who ignores what matters. You are someone who looks for answers, and the answers exist. You have several of them right now. If this video gave you something, a new understanding, a moment of recognition, a sense that you are not as alone in this as you thought, please share it with someone who might need it. Leave a comment below telling me which part of today's video resonated most with you. Your comment might be exactly what another man needs to see to know he's not the only one. And if you haven't subscribed yet, do it now. Every week on this channel, we go deep into the conversations that men's sexual health actually needs. No fluff, no shame, just real answers. Don't forget to check the pinned comment for the protocol program I mentioned. The full link is right there waiting for you. I'm Dr. Ella Parker. I'll see you in the next one.